In pregnancy, there are a lot of changes happening in your body. And sometimes if you have a question or a concern, you might not know who to contact. So for non-urgent questions, your community midwife would be a good point of call. They are open weekdays and they will give you their number. You can ask them any questions at all, and no question is a silly question. And some midwifery teams across the country have social media pages or Ask the Midwife service where you can text or email a question. Obviously, this is for non-urgent questions and queries. You could also access NHS websites for generic pregnancy information. And you might also like to write down your questions and take them to the next midwifery appointment with you. There will be times when waiting until your next appointment is not advisable. If you have any of the following symptoms, or if you're worried about anything at all, then please contact your midwife, your GP, or your local maternity unit where they will have a triage. If you have any bleeding from your vagina at all, please seek advice as soon as you can. There is a separate video about bleeding in pregnancy that goes into a little bit more depth. Any problems passing urine, such as burning or stinging when you are going to the toilet, could be a sign of urine infection. Any pain in your lower stomach or your back, or especially if you develop a high temperature, these could be a sign of a urine infection and may need treatment. You can seek advice from your doctor or your midwife. Any severe vomiting that stops you keeping any food or drink down and that prevents you eating and drinking may need attention, so you could seek advice from your GP or your triage unit. Sometimes women can become dehydrated in pregnancy, and sometimes they need to be taken into hospital to have fluid replacement. Any leaking from your vagina should be classed as abnormal, especially if this is a watery fluid or any discharge that smells different or is any other colour than clear. This can be a sign of infection, or it could be a sign that your waters are leaking. So any fluid leaking from your vagina should be checked. If you have any abdominal pain that isn't going away with or without bleeding, or with or without any fluid leaking, any abdominal pain should be checked. If you're experiencing any painful tightenings in your stomach, this could be a sign of labour. And if your pregnancy is over 37 weeks, then this can be a sign that you are going into labour. This can be normal. However, any abdominal pain or any tightenings in your stomach that occurs before 37 weeks, you will need to seek advice from a healthcare professional as soon as possible. Any signs of itching, especially in the hands and feet, this can sometimes be indicative of a condition called obstetric cholestasis and will require a blood test. So if you're concerned about any itching in your hands and feet, please contact your midwife. There are also signs of preeclampsia, so any severe headache, visual disturbances, epigastric pain, swelling in your legs, hands and feet, face, and any sign that you might have raised blood pressure, or if you're just feeling unwell, then please contact your local maternity unit. There is a separate video about preeclampsia which goes into a little bit more depth. From 20 weeks or so, you should start to feel your baby moving. And from 24 weeks, your midwife will talk to you about a pattern of movements. They will ask if your baby has established a pattern of movements. And what this means is some babies will move more in the morning, some babies will move more in the evening. But what you will be asked to do is to start to recognise and learn your baby's pattern of movements, because any deviation from this normal routine, so if they usually move in the morning and then for one morning they're not moving as much, then you would be asked to contact your local maternity unit and report a reduction in your fetal movements. You may notice that everything I've spoken about so far involves you phoning somebody, so phoning a GP or phoning your midwife or phoning your local maternity unit. And I just wanted to mention that if you find speaking on the telephone difficult, you can discuss this with your midwife at one of your appointments, and they can put in something called a reasonable adjustment. So they can put a note in your hospital notes to say that you find speaking on the telephone difficult and that you will have somebody calling on your behalf. If you're calling your local maternity unit, they may not have this information to hand. So if somebody is calling on your behalf, they would need to state that, you know, their partner is autistic and they find speaking on the phone difficult. So during maternity staff training, midwives are advised to always speak to the women themselves, because sometimes women aren't safe at home or they live with people that control them. So midwives will often insist on speaking to the person themselves. So having a reasonable adjustment put in place might make things easier. Also, if you're calling the maternity unit because you're in labour, midwives often want to speak to you because they want to determine how often your contractions are coming and, you know, how you're experiencing labour yourself. So if somebody is calling on your behalf, please stay close to the phone, because the midwife will want to ask some questions and they can ask that through the person who's calling on your behalf. They don't have to speak to you directly, but be aware that you'll need to be near the phone to answer those questions. For further information on anything that I've discussed in this video, please see the other videos in this series. Thank you.